You know, for so many people, chronic knee pain from osteoarthritis feels like a dead-end street. It's just a cycle of treatments that don't really offer lasting relief. But what if the answer wasn't some new drug or a major surgery, but a focused beam of sound? Today, we're diving into the evidence behind shockwave therapy. Can it actually break that cycle of pain? Let's find out. For millions of us, knee pain isn't just a now and then kind of thing. It's a daily battle. It literally changes how you walk, how you work, and how you live your life. And it really makes you wonder, are the treatments we have right now actually enough? Are they really getting the job done? So, the culprit behind so much of this widespread pain is knee osteoarthritis, or OA for short. It's so incredibly common that the research we're looking at today calls it a full-blown public health crisis. And this isn't just about achy knees either. It gets more serious. Studies have shown it can be linked to increased mortality, mainly because the pain just stops people from being active. Now, if you've ever dealt with knee OA, this whole list probably looks painfully familiar. It's what I call the treatment treadmill. You start with painkillers, right? Things like NSAIDs, that's your non-steroidal anti-inflammatory drugs, but they can come with some pretty serious side effects. Then you move on to injections, which, let's be honest, often only give you temporary relief. And before you know it, you're looking at surgery as the last and most invasive option on the table. You can see why researchers are desperate to find a better way. Well, this brings us to a really interesting potential solution: extracorporeal shockwave therapy. The whole idea is kind of simple, but also really powerful. You use focused sound waves to get the body to kickstart its own healing processes. But the big question is, does it actually work? So what is ESWT exactly? Well, to put it simply, it's a completely non-invasive and non-surgical treatment. A special device generates these high-pressure acoustic waves, basically sound waves, and directs them right at the painful area. The goal is to wake up your body's healing and regeneration mechanisms, all without ever breaking the skin. So how does a sound wave trigger all this healing? Well, researchers think it sets off this amazing cascade of effects. The shock waves stimulate tissue to regenerate, and they ramp up blood flow to the area. And what's really crucial here is that studies suggest they can actually slow down the breakdown of cartilage and even change how your brain receives pain signals from the joint. It's like a multi-pronged attack on what's causing the OA pain in the first place.
Of course, talk is cheap. These are big claims, and they need solid proof. So, a team of researchers decided to put it to the test and rigorously evaluate all the existing evidence. They wanted to find a definitive answer on whether ESWT is the real deal. Let's take a look at how they did it.
Now, they didn't just run one more small study. No, they went bigger. They conducted what's called a meta-analysis, which is basically a powerful study of studies. The technique involves pooling all the data from multiple, high-quality clinical trials to create one massive statistically powerful result. So, to build this super study, they started by casting a really wide net. They combed through all the major medical databases, and their first search pulled in 57 different articles that seemed like they might be relevant to shockwave therapy and knee osteoarthritis. But here's the thing: not all studies are created equal. This flowchart shows their incredibly careful filtering process. They started with those 57 records, got rid of duplicates, and then painstakingly assessed the 35 that were left. They tossed out studies that weren't focused on the knee or that just didn't have enough data until they had boiled it all down to just 9 high-quality trials that met their super strict criteria. And by combining those 9 studies, they ended up with a really powerful data set. The analysis included a grand total of 705 patients. Now, that is a large enough group to give their conclusions some real statistical muscle, some real weight and reliability. Okay, so the moment of truth. After all of that rigorous work, what did the data actually have to say? Let's get to the results and see what the evidence shows. For anyone who's in pain, let's be honest, this is the first and most important question. You can forget all the biology for a second. The bottom line is, did the treatment actually make people's knees hurt less? Okay, I know this chart looks a little complex, but it tells a really clear story, so stick with me. Each of those horizontal lines represents one of the studies they analyzed. That line right down the middle at 0 means no effect. Now, anything to the left of that line means the treatment worked. And you can see most of the studies are leaning to the left. But the most important part is that diamond at the bottom. That's the combined result of all the studies, and it is clearly, firmly on the left side, showing a strong positive effect for shockwave therapy. And here's what that diamond represents boiled down to a single number. On a standard 10-point pain scale, it's called the Visual Analog Scale, or VAS, the Shockwave group had an average pain score that was 1.59 points lower than the control groups. And that is a clinically meaningful reduction in pain. And get this, it happened within just 2 weeks. All right, so the pain went down. That's fantastic. But knee OA isn't just about pain, is it? It's about function. It's about being able to live your life. So could patients actually move better, walk better, and just manage their day-to-day lives more easily?
And this chart answers that very question. This time, it uses a measure called the WOMAC score. That's basically a detailed questionnaire that looks at pain, stiffness, and your ability to do daily tasks like climbing stairs. And just like before, a result to the left of that center line means the treatment helped. And once again, look at that diamond at the bottom. The combined evidence shows a clear benefit for the shockwave therapy group. And here's the impact in numbers. The pooled data showed an average improvement of nearly 12 points on that WOMAC scale for the group that got ESWT. Now, for a patient, an improvement of this size means a really noticeable difference in their ability to just get around and live with less limitation. It confirms the benefits go way beyond just pain relief. People were genuinely functioning better.
Now, a big concern with any new treatment is always, well, does it last? And you know what? The meta-analysis found that the pain relief wasn't just some flash in the pan. The reduction in pain was still statistically significant a full 6 months after the treatment course had finished. And finally, we have to talk about the all-important question of safety. So across all 705 patients in these studies, what were the side effects? Well, they were overwhelmingly minor. We're talking about temporary, localized swelling or maybe a little bruising right where the treatment was applied. The crucial takeaway here is that no serious adverse effects were reported at all. So let's pull all of this together. What is the final verdict from this really deep dive into the evidence? And what does it all mean for patients who are out there struggling with knee OA? Well, the study's own conclusion says it all loud and clear. They state that using ESWT for knee OA reduced pain and improved functional outcomes, with effects that could last anywhere from 6 months up to a year. That is a powerful endorsement, and it's based on a really comprehensive review of the science. You know, this leaves us with a really powerful question for the future. We're looking at a safe, non-invasive treatment that shows clear, lasting benefits. So could therapeutic sound waves become a new frontline defense in the battle against chronic joint pain? Based on this evidence, that future is looking more and more possible.